here to give us some important tips for women and how to make their gynecological health a priority. And thank you so much for joining us.
Thank you for having us.
You're here to tell us about National Women's Health Week and gynecological health coming up in May, and there's hospitals who are going to be running all sorts of events to get women to think about this seriously. Andie, how did you get involved with this, first of all?
I had a really dear friend of mine that was diagnosed with uterine cancer, and it was my wake-up call to get involved with women and to encourage women to be advocates for themselves. Fortunately, she listened and listened to the symptoms and went in early. But since then, I've met so many women that really procrastinate and going to their doctor because it's quite often very subtle symptoms, particularly for ovarian cancer. It can be as simple as a backache, and they postpone going to their doctor. So I really encourage women to educate themselves by going to womenshealth.org and finding a hospital that's participating with Women's Health Week event.
Right, and that's coming up in May, right, Doctor? That's May 13th through the 19th. How are hospitals going to be getting on board?
Well, that's the Women's Health Week, but really this effort goes on all month. We're having programs all the way through to May 31st, and there are hundreds of hospitals having physician-led programs at their hospitals just to educate women on what are the common symptoms of gynecologic issues, what are the normal screenings that they should be getting. We're really hoping that with that information, it's going to motivate women to come in. So again, womenshealth.gov will give you all the information on the scheduling. Hopefully you can find a program near you.
Yeah, and that's the great thing is that, you know, if you're already doing the things you need to do to take care of yourself, that's great. I know a lot of women get a reminder card in the mail. I know my doctor does, and they say, don't forget, make your appointment. And it's become a priority because, like you said, Andie, there are those symptoms that, you know, can mimic other things that then could turn into more serious things.
Yes, that's correct. And I think also I just think women have a tendency to be caretakers. They put themselves last on the list. So part of this whole program is to encourage women to really be advocates for themselves and to take control of their health.
And there's a lot they can do, right, Doctor?
Yes, we're focusing on dangerous things like cancer, but in reality, most women who are suffering with bleeding and pain, it may be the fear of cancer that keeps them from coming in, but most don't have cancer. Most have common things like uterine fibroids, endometriosis, that may not threaten your life, but can wreak havoc on your quality of life. And so there's lots of information we can give out on that as well.
Womenshealth.gov. Thank you, Andie and Doctor. We appreciate your time.
Thank you so much.
Thank you.